So Dr. Karen came in and saw you?
Yes.
Did you get all your questions answered?
Yes, yes.
Okay.
He said everything was looking really, really good.
Okay,
So,
Mama. Okay, good. Okay, so what I'm going to do from here then is get the ointments put back on.
Okay.
Really, your incisions look pretty clean, but I'll kind of go over like how you're going to clean those.
Okay.
Starting tomorrow. But yeah, I mean, they look really good. So, but we'll go over that a little bit, and then I'll put the ointment on, and we'll get you wrapped back up. Sound good?
Perfect.
Okay. So what we're going to start with is the hydrogen peroxide and Q-tips, and this is what you'll start tomorrow as well, but we'll go ahead and clean them up a little bit today too. Okay. So you're just going to soak the Q-tip. You're just going to take it right along the incision. So you're just going to kind of roll it along there. And any place that you may have a little bit more dried blood, you can leave it on there a little bit longer and really soak it. And then, like I said, when you go to get in the shower, it should rinse off pretty easily for you. And then we'll do under the chin here now too. So just do a little bit here and just kind of roll along, but your incisions look really nice and clean. And you can do this along the eyelids too, that's fine. Just be really careful with it. Make sure that the Q-tip isn't dripping or anything like that. You just want to roll it along there as well. And just be really careful because this can be more of a tender spot, and of course you don't want the hydrogen peroxide in the eye. So you don't have to, those really good. Okay, and so then when you go to shower, then those will come off a lot easier. Okay? All right, so the next thing I'm going to do is I'm going to move on, and I'm going to reapply the ointment to the eyes, the Lubrifresh ointment that we put on you yesterday and that we've also sent home with you. So we'll do that here. This is just something you want to make sure that stays on all the time. You don't want those incisions dry out. It's going to help when it gets kind of to the itching process. And then when you come to get those stitches taken out, they're going to slide right out instead of kind of being stuck in there. So it'll be a lot easier on you. Okay, and we got a little bit more. And we'll put some on the lower one. So if you can look up for me as much as you can. We'll put some down here. Okay. And then we'll do the other eye. I'm actually going to dab at this other one here because you do have a little bit of oozing right there, which is also very normal. There we go. And then we'll just roll on a little bit for down here as well, making sure these all stay nice and moisturized here. Okay. Doing okay so far? Okay.
Yes.
All right. So then you're actually going to start tomorrow by putting the Aquaphor ointment on these incisions here and this one here. But I'm going to go ahead and do the triple antibiotic ointment again like we put on you yesterday.
Okay.
So I'll do that today, and then tomorrow you'll start with the Aquaphor on there. Okay, so I just use a tongue blade here. Underneath here. right. And then because of the bandages and everything, we need to reapply the ointment for the laser as well.
Okay.
So we'll go ahead and get that put on too. Okay, so I'm going to start on this side and we're just going to reapply this. This is really, really important to make sure the laser areas that were treated, make sure that those stay with this on it, because you don't want this to dry out. You want to make sure that it's nice and moist.
Okay.
And I know that bleeding and like the pinpoint bleeding that you have and the crustiness is kind of bothering you right now. Like I said, you'll be able to wash that off and get that off of there. So that'll help out a lot. Be able to get that off. Doing okay still? Okay. And I'm going to go ahead and put some on the lips here, around the lips. And go make sure you get a little bit under the chin too, because the laser went below, so don't make sure you don't miss an area. Okay. Then we'll come to the other side here. Okay. And you can put this on with your hands. It won't hurt anything to do that. Just make sure your hands are nice and clean.
Okay.
Again, just making sure that you get under the chin and all the areas that were treated by the laser. Okay. So the next thing that we're going to do is we have 2 dressings that we're going to put on today.
Okay.
Starting tomorrow, you don't need to wear this one anymore. Okay. So we're going to wrap this one first. It's just going to, because you're still going to be kind of maybe bleeding, oozing a little bit today, have a little bit of drainage. So it's nice to have this one on in between your face and the ACE bandage here. So can get this one open. It's kind of hard to do with the gloves on. Okay. And then, so yesterday's went around this way too. We're not going to go that way. We're just going to go strictly that way. Okay. So you won't have to worry about going around. We're just going to come around this way. And we're going to come underneath and make sure that incision's nice and covered there. And there doesn't need to be a lot of pressure. Just enough to make sure that where he's worked underneath lays nice and flat there. Okay. And it heals nicely for you. So just wrap this around. And like I said, this one will come off tomorrow, so you won't have to reapply this one.
Okay.
Okay, so let that hang there a minute. And then this is the ACE bandage that you will wear the next 5 days. So we want you to wear as much as possible. But of course, while you're showering and that kind of thing, take it off and then just put it on afterwards. And you can put like some gauze in between this and your incisions if you want to keep this a little bit cleaner.
Okay.
It can also be washed too, but you wouldn't really have the time to have it off for that long. But really what this is doing is just protecting those incisions and then keeping a little bit of pressure on there. So you're just going to continue to wrap around here. And then it just Velcros to itself, so that makes it easy.
Simple.
Yeah, and that's it.
Okay, so
Okay.
not pressure, really, just enough to hold it
Yeah,
together.
just the
Okay.
whole, yeah, you don't want anything too tight. The compression dressing was yesterday. That one was a little bit tighter. But this one, not too tight, just a little bit of pressure there, but nothing like yesterday's. Okay?
Cool. Thank
Any
you.
questions?
No, so it's for 5 more days.
Mm-hmm.
Is today one of those 5 days, or?
Yeah, today will count as one, and then for 5 days, well, for 4 more days then after today.
Perfect.
Okay?
Cool, thank you.
All right, you're welcome. If you have any questions, don't hesitate to give us a call. We're here. And then, of course, you have Dr. Karam's cell phone number and home number. So if anything comes up after hours, overnight, or over the weekend, you can definitely call or text him anytime. Okay?
Perfect. Thank you so much, Stacey.
You're welcome. Have a
Appreciate
good day.
You too.